So you guys, laboratory test on the baby. Remember we get those 5 dots. Has everybody seen a PKU now? Has everybody seen it? So you guys, we're testing for this metabolic disorder. You guys, if you have phenylketonuria, that means that you have protein in your blood that you cannot metabolize. It's from your diet, okay? That protein will go to your brain and cause brain damage. So we identify it very early, within 1 to 2 days of discharge. And you guys, if it's positive, we talk to the pediatrician, and then you're on a special diet so that you don't get brain damage. Also, you guys, there's a big list of galactosemia. All the metabolic disorders are included when this screen is done.
It's required by law.
Required by law. Yep, required by law. And the state of Florida pays for your diet from then on to make sure that you stay on it. You have a big catalog of food you want to eat, all that stuff. So a heel stick, you guys, where do we want to stick them? Outside lateral quadrant.
Can you repeat the first part?
Where do we do a heel stick? On the outside lateral quadrant. 1, 2, out here. Now do you see how small this medial area is? Look what risk for damage to these nerves are, you guys. Don't do medial, do lateral. Lateral is where you're really supposed to do it. Okay, so can you get blood from a turnip? Cannot get blood from a turnip. What the heck does that mean, JBT? That means there is no blood in a turnip, so you can't get it. So dudes, what that also means is you have to heat up a heel because there is no blood there. Can you get blood from a heel of the baby that doesn't have blood in it? No. So you guys, what do? You heat it. How do you heat it? Well, heat pack. Do you use a diaper? No. It is not regulated. So you can't use a diaper any longer. You use a little heat handy pack to heat the heel to exactly the temperature that you need. Okay, so this is a common problem, hypothermia, right? Less than 97.7. You guys have to know that number. You have to know that number. So why would somebody get hypothermia? Because they don't have enough, two words, brown fat. Absolutely, Tia. So they don't have enough brown fat. These dudes did not have enough brown fat. They were premature. They never made it. Post-mature, they used it in utero because they couldn't get any going through the placenta. Small for gestational age or nutritional deprivation. Signs of cold stress, increased activity level, crying, respiratory rate, cyanosis, mottling. Nursing care, dudes, if they're cold, first of all, screen them. And an axillary temperature is a screen, right? What is a diagnostic of cold stress? A rectal temperature. Doesn't that make sense to you guys? And if they're cold rectally, dudes, we need to put them under the warmer, right? We need to put them under the warmer and warm them up. We may need to give them O2. And then when they're stable, we're going to tightly wrap them, keep the hat on, and tell the parents. See that, you guys? So you guys obviously know that with an O negative mom, with an O mom, you can have ABO incompatibility. That's if the baby is A or B. Okay? Have an O mom with an A or B or AB baby. Okay? Now, IgG antibodies cross the placental barrier, so the ones that are going to say lyse these red blood cells cross mom's uterus, go to the placenta, go to the baby. We will have a positive direct Coombs. We will have a positive direct Coombs test. A positive direct Coombs test is the blood taken from the baby that says there's going to be fetal lysis of cells, or neonatal lysis of cells. If the Coombs is positive, it tells us that the baby is going to be jaundice, direct Coombs positive. You guys, it goes +1, +2, +3, +4. If you have a +1, we're very diligent to really watch and to feed. The more you pee, the more you poo, bilirubin, the more bilirubin, the out the chute. So dudes, if you have a Coombs positive, your big nursing intervention is to feed them, or to make sure that they feed, promote feeding, because you want them to get rid of those. Yes, we want to get rid of the bilirubin that is conjugated, right? Conjugated. So it's less severe than RH incompatibility. Remember, our aging compatibility is a negative mom and a positive, what? Baby. And the previous baby did what? Inoculated her because she didn't get a rodam, right, you guys? And would this be a positive Coombs? Yes. We've talked about all this. So you guys, what is your primary nursing intervention? Feed. Feed, feed, and assess, right? So you guys, what is a screening tool for elevated bilirubin? How do you screen for elevated bilirubin? Screen.
Absolute and
Screen. Transcutaneous bilirubin levels. You guys should have all seen these in the hospital by now. Let's look. I love it. Here it is, right here, dudes. Have y'all all seen this? Yeah. Transcutaneous bilirubin meter. See this right here? So you guys, all it does is it reads how much bilirubin is trapped in those little superficial vessels, which also makes the baby what? Yellow in color. This is a screening tool. This is a screening tool. So screening tools are less what? Accurate. What would be a diagnostic or a more accurate tool to know exactly what the bilirubin level is? Serum bilirubin level. And then how do we plot it? We plot it on a what? A nomogram. Remember that? We talked about this that one day. Remember this? Okay, so you guys, you have to know what the serum bilirubin is. Here's the hours. So dudes, if you're 24 hours and your bilirubin is, let's say you're 48 hours and your bilirubin is 10. You're in the low intermediate zone. But what if you're 12 hours and your bilirubin is 10? You're in terrible shape. This is what all of these high-risk zones, these intermediate and high-risk zones, they go on Billy lights, right? And how do Billy lights work?
UV lights.
It changes the bilirubin from unconjugated to partially conjugated. Right, Vicki? Lumen rubin or lumen rubin. They're interchangeable. Okay, is everybody good with that? So dudes, why do babies well, it's common in both, let's just say that. So dudes, why do you not want your baby to have a high bilirubin level? Connector. So you guys, once the bilirubin level hits 21, it causes brain encephalopathy. Do you ever like the words encephalopathy? No, dude, that's when your brain is decaying and shrinking. Okay? So we never want it to get to 21. We can use a screening tool known as a transcutaneous bilirubin meter, or we can use a diagnostic tool such as serum bilirubin to determine the levels. You guys have to know this one number right here. So patho means what? Disease producing, right? You guys know that patho means disease producing. So pathologic jaundice or disease producing jaundice is if you have a bilirubin of 5 or greater in the first day, we've got problems. We've got big problems, okay? That's pathologic jaundice. But dudes, a lot of babies have physiologic jaundice just because they had a lot of red blood cells, came from the placenta, they got a lysum, they got some bruising, their liver is slow. Almost half the the newborns have physiologic, physio means what? Normal function, jaundice after 24 hours. But we just never want it to go above 12. Usually disappears within 7 days, right? If you go under BILI lights, what do you have to cover? Eyes and genitals. Okay, Jenny's? Genitalia? Y'all never used that before?
How do you spell that?
G-E-N-E-S. Good old Jenny's. Okay, so dudes, why would breastfeeding jaundice be an issue? Tell me about how does breastfeeding, let's talk about the breastfeeding mom, breastfed baby and the bottle-fed baby. Tell me what's happening. Volume. So dude, this volume baby over here, is it going to poop and pee alive? Yeah. This breastfed baby has to work at the breast, right? And the amount changes every feed. So there's a lot of supply, it's a supply and a demand system, right? So this poor breastfed baby is getting a lot less volume, right? That's just the bottom line. Until the mom's breast milk comes in on day 5 to day 7, the second breast milk that's voluminous, okay? So dudes, yes, you can get jaundice from breastfeeding just because you have decreased what? Volume. So what do you think you would do? What do you think would be the normal standard of care for someone who had breastfeeding jaundice? Supplement. Here it is. All the same things. Phototherapy, protect the eyes, turn them every 2 hours, maintain hydration, monitor temp. Geez, they can get hot in there. Okay? Have to monitor the temp because they've got the warmer on and the lights. Okay? Urine-specific gravity, why do we even care about that? If it's elevated, they are dehydrated. Yeah. And then eyes and nose. There it is. These are eye patches, and this is eye patch. What is this thing?
The baby box.
This baby box is called an isolate. And why do we even use this? What is it magic?
It decreases the sound levels.
Well, but more importantly, it's a what? It's a patient room. This thing is 90 degrees, dudes, in here, because this baby has no brown fat, okay? And do we want to stand in a 90-degree room? No. So dudes, I always want to demystify this. This is not magic. You guys go, oh, they're over there in that box. I'm like, okay. You know what I mean? It's not magic. It's just a hot box because they don't have any brown fat, okay? That would be huge. All right, phototherapy blankets. You should have gone there, Colin. You know that if you put it out there, dude, I'm going to take it. All right, so phototherapy blankets, you guys, this is phototherapy, and we can just lay them on with this blanket. Has anybody seen these in clinical practice? I think you have, Ryan. This is my nursery nurses. Anna, you guys saw some of these. But these are good. We can take these home. Here's a little fiber optic bed. Here's the blanket as well. Here's therapy. Exercise. And just listen. Hypoglycemia, we know we don't want it to be less than 45, right, you guys? Who's at risk for this? Everybody's at risk that had any problems, that was gestational diabetic, that had any kind of labor problems, and the baby was small, the baby had a hard labor. Everybody is at risk for this, unless everything was completely 100% met with your labor and with your prenatal care. Which is that everybody? No. I mean, most people do not have everything perfect. Predisposing factors, malnourishment, maternal diabetes, you guys know this. Severe RH incompatibility, what would that be? They could be hypoglycemic from that. The change in the vasculature. So you guys, when you start having all this lysis and calcium and all these things that are changed, it can decrease your blood sugar. What are signs? Apnea, lethargy, irregular respiration, poor feeding, jitteriness, twitching, high-pitched weak cry. So you guys, how do we know that this baby has low blood sugar? We test their blood sugar. Yeah, we do a heel stick and we test it. You guys, we can, now this is what we do on some places. We just try to get them through this tiny period. And why would we give this? Why would we give this instead of a bottle? It's concentrated,
It's fast.
more like it's fast, and it's more like what? The volume of breast milk they would get. Whereas if you get a nurse who comes in there and is like, oh, I have a bottle, you pause on 1 second.